I will use my time today to outline at a high level what we might expect in regards to healthcare reform efforts during the Biden administration. There are many unknowns. That's my theme for today. In addition, I will offer some commentary, late-breaking commentary, on the TennCare block grant waiver approved by CMS just 8 days ago, already approved by our Tennessee General Assembly, and currently awaiting Governor Lee's signature. Let's start with expectations from the Biden administration. Biden has a long history with the Affordable Care Act. He was vice president when the Affordable Care Act was passed in 2020. It's no surprise that his approach involves expansion of the Affordable Care Act. On the campaign trail, Biden emphasized two things. The first is increasing access, and the second, reducing cost. Next slide, please. We will look first at strategies for increasing access outside of the Affordable Care Act. One of the cornerstones of what President Biden campaigned on, President-elect Biden campaigned on, was making long-term care more affordable through changes in the tax code. So this includes, for example, allowing a $5,000 tax credit for informal caregivers. Next, and it's a big item, is lowering the age for Medicare eligibility to 60, and then increasing funding for mental health and rural healthcare services, which I think you will agree are very high priorities in our state. Next slide, please. Now, when we look at how access will be expanded within the ACA, we're going to look at three things in particular. The first is eliminating income limits for premium subsidies. Currently, the limit is at 400% of the federal poverty level, and Biden has proposed that that would be eliminated. Next is a new idea, and that is to limit the percentage of income people pay for healthcare coverage. And the cap that has been suggested is 8.5% of income. Last, and this is a very big item, is the addition of a public option plan. It would be offered through the Affordable Care Marketplace. It would extend eligibility to people who have access to employer coverage. That's a little different than we've heard before. It would be administered by Medicare. Medicare would have the opportunity to negotiate reimbursement rates for hospitals and providers. And this is big for Tennessee, the public option plan would be available to uninsured individuals in non-expansion states, such as Tennessee, with one caveat that the state needs to continue to pay their current share. Next slide, please. Reducing costs centers on two primary strategies. The first is addressing prescription drug costs. Strategies that have been suggested is Medicare negotiating prescription drug costs for both public and private plans and allow people to buy drugs from other countries when those drugs are available at a lower price, and then end surprise medical billing. Now, what's noteworthy about the two strategies I've mentioned for reducing cost is that there is bipartisan support for these ideas. These are not strictly Democrat or Republican ideas, they're shared. Next slide, please. One of the other things that President-elect Biden and others campaigned on and continue to talk about is the restoration of rights that have been eroded in the past 4 years. Biden has emphasized restoring free access to preventative care, including contraception, and healthcare protections for all people, regardless of sex, gender identity, or sexual orientation. Next slide, please. Well, let's pause a moment. Biden's agenda is very ambitious, and the path is uncertain. The Biden administration faces challenges, a plethora of them, regarding the ongoing COVID-19 pandemic, social unrest and discord, and political division. These are the environment in which President-elect Biden will try to affect the changes. Next slide, please. President-elect, Biden's number one priority is COVID-19 pandemic response. He proposes expanding the role of the federal government in testing, contact tracing, and resource deployment. And we heard some of that in his speech earlier this week. He wants to increase funding to states, localities, and individuals. But these actions require the approval of Congress, so we'll see how that goes. Healthcare reform in Biden's plan follows the pandemic response. When we look at healthcare reform, the priorities in order are coverage expansion and ACA stabilization, health equity, decreasing the age for Medicare eligibility, drug pricing, and surprise medical bills. Now, we all know from our civics lessons that reform can happen at many levels, and some options available are easier than others. So let's take a tour through the three branches of government. Next slide. We will start with the executive branch. The Department of Health and Human Services can roll back Trump deregulations to restore Affordable Care Act programs and policies to prior interpretation and implementation. The Department of Health and Human Services can also use Section 1332 waivers to support state public option plans. They can also fully allocate ACA enrollment outreach support, which has been severely eroded the last 4 years, and reverse Medicaid work requirements. And as we know, in the past two administrations, executive orders can be used to affect healthcare reform. So that option is available. Next slide. We almost have forgotten about this with so many other things going on, but in late spring or early summer, the Supreme Court will uphold or overturn the entire ACA or key provisions. So the Supreme Court the decision will define limits on reform possibilities and possible paths forward. So this is something that lies ahead. Let's turn our attention on the next slide to Congress. Next slide, please. Yeah, thank you. Congress is where lowering the age for Medicare eligibility and the public option will happen, as well as removing the 400% federal poverty limit for premium subsidies. We also could expect that mitigation of the impact of the ACA lawsuit ruling might happen in Congress. Don't know till we know what that ruling is. But let's look at the reality of the legislative path forward. Next slide, please. Democrats have the slimmest of a majority in the Senate. This could be an issue because of the filibuster. 60 votes are needed to close the filibuster, and 60 votes may very clearly be outside the reach of the Biden administration. However, reconciliation might be employed by the Biden administration as a way to get healthcare reform legislation passed in Congress. Reconciliation expedites the passage of certain budgetary legislation, only requires 50 votes, so it can be used to prevent the filibuster. And as we remember, it was used previously to pass the Affordable Care Act. So look for more chatter about reconciliation. One of the other things is we expect the Biden administration to prioritize those issues with bipartisan support. So prescription drug pricing, pricing transparency, telehealth, which is big for Tennessee, and mental and behavioral health. I'm going to turn my attention now to the TennCare 3, what we're referring to as the block grant waiver. As I've already said, 8 days ago, the federal government approved a 10-year renewal of TennCare, Tennessee's full replacement Medicaid program, and the TennCare 2 waiver was set to expire June 30th, 2021. So as I've already said, the Tennessee General Assembly waived their usual legislative rules to approve the TennCare 3 waiver, and the bill that passed is now awaiting Governor Lee's signature. Although I did fail to look this morning, I don't think it was signed, but it could have been. Next slide, please. So I'm going to, on this slide and the next one, outline key provisions of the TennCare 3 waiver proposal, and we'll talk about a few of these in more detail. It's possible that Tennessee may receive more federal dollars without the required state match. So just a reminder, for every dollar spent or saved in TennCare, 65 cents comes from the federal government and 35 cents from the state. TennCare 3, the waiver, will allow TennCare to be the first state with a Medicaid program to limit coverage of certain prescription drug costs. This is major. Again, we're going to be an incubator of either reform or experimental state in that regard. The TennCare program will be able to make eligibility and benefit changes without further federal approval, but there are some guardrails here. As long as you maintain or improve the end of 2020 levels. So that is not something that was in the proposal that was submitted to CMS. So that's a change that was made. Next slide, please. New funding cap may actually be less risky than the current program, because remember, we were facing a renewal period June 30th, and some states have already received renewals, and it's not business as usual. One of the big provisions is a shared savings plan, and I will talk about that more in a second. And then in a parting shot, the rollback of the waiver could take longer than prior waivers. This was some things that was put into the waiver approval by the Trump administration that will make it harder to reverse this than it would have been prior to the changes. Next slide, please. One of the hearts of the TennCare 3 waiver is the aggregate funding cap. So let's look at a description of what it is. The aggregate funding cap, which will be on a per capita basis, the base will come from actual Tennessee 2019 per capita cost in the 5 traditional categories of Medicaid. And what will be added is a national rate of growth to establish the 2021 cap. So we start with actual experience from 2019, pardon me, and then inflate it with national numbers. Then on an ongoing basis, the national rate of growth and enrollment will be factored in if it's plus or minus more than 1%. Now, another thing that differs in the waiver that was approved and what was submitted by the state is the cap applies to all costs covered by the waiver. The state had suggested that certain Medicaid expenses would be excluded. Next slide, please. It is very noteworthy that the state has been given the green light with the waiver to begin to look at lowering the coverage of prescription drug cost, and we would be the first state to do this. So what basically it means is TennCare can choose not to cover some prescription medications, but there are exemptions in regards to HIV/AIDS and opioid use disorder medications. And furthermore, there's a caveat, but we'll have to see how this plays out, that the state must allow exceptions when a non-covered drug is deemed medically necessary. We have some history with that, and it hasn't always gone smoothly. Next slide, please. The last thing in my quick tour through the TennCare 3 waiver is to look at the shared savings, which are certainly being touted this week by various state legislators. So let's be clear, the state has financial incentives today, and they will even more so under the waiver, to reduce TennCare spending. But, and this is something that I take some solace in, reductions in eligibility and benefits below December 31st, 2020 levels are prohibited without federal government approval. So let's look at this chart that I put together using work from the Sycamore Institute. In TennCare 2, our current program, if there were $3 saved, the feds would basically save 2 of those $3 and the state would save 1. That's because of our 65-35 split. Under the TennCare 3 waiver, if $3 were saved, the feds would retain 1 of those $3, and 1 of the dollars that they would have retained previously would come to the state through the shared savings program, and the state would have their $1. So perhaps in the questions and answers, we can talk more about this. Last slide, please. This picture illustrates 2 key points. There's a long ways to go, and there's a lot we don't know. That theme of uncertainty. So I look forward to speaking more about TennCare 3 if that's the will of the participants, and answering questions about the proposed program. Again, this has all emerged in the last 8 days, so we will do the best we can to answer your questions, and I may call on some of the experts from the panel or among the participants. Thank you for my time with you.
Thank you, Dr. Myers. I think it's worth reminding ourselves that this could potentially change, and we anticipate it will change with the new Biden administration. So we just have to sort of roll with the punches and go with it. But I think understanding the ins and outs will help us be prepared to have conversations with policymakers and other stakeholders on the ground.
Yeah, I hope we can talk specifically about that in the question and answers. Thanks so much, Tanae.
Yes.